What if the future of medicine isn't pills, but tiny chains of amino acids that can control hunger, repair tissues, reverse disease progression, and even extend human lifespan? What if the next 5 years completely redefine how we treat obesity, diabetes, aging, and recovery, not through traditional drugs, but through precision-designed peptides? And after everything we've already explored on peptide culture, from understanding peptides to breaking down retatrutide, its benefits and risks, comparing it with tirzepatide, exploring fat loss stacks, and diving into growth hormone peptides, today we're stepping into the future. Because this is bigger than fat loss. This is about the top 10 peptides that could change medicine in the next 5 years. And trust me, this list is not hype. This is based on current research pipelines, clinical trials, and real-world momentum as of early 2026. Let's start with number 1, the peptide that has already shaken the world of metabolic medicine, retatrutide. We've already discussed this in detail in previous videos, but it deserves the top spot. Retatrutide is a triple agonist peptide that targets GLP-1, GIP, and glucagon receptors simultaneously. That means it doesn't just reduce appetite, it may also increase energy expenditure and improve metabolic flexibility. In early trials, it produced weight loss numbers approaching 24%, which is unprecedented. But this isn't just about weight. This level of metabolic control could transform how we treat type 2 diabetes, cardiovascular disease, and obesity as a chronic condition. If phase 3 trials confirm long-term safety and efficacy, retatrutide could become one of the most important drugs of this decade. Now number 2, tirzepatide. Marketed as Mounjaro and Zepbound, tirzepatide is already changing lives globally. It's a dual agonist peptide targeting both GLP-1 and GIP receptors. Compared to earlier GLP-1 drugs, it delivers greater weight loss and better glycemic control. But its real impact is broader. It's shifting the perception of obesity from a lifestyle issue to a treatable hormonal condition. Over the next 5 years, tirzepatide and its next-generation versions could become standard care for metabolic health. Number 3, semaglutide. Known through Ozempic and Wegovy, semaglutide started the modern peptide revolution. While newer peptides may outperform it, semaglutide's global adoption, accessibility, and long-term data make it foundational. It proved that targeting appetite hormones works, and it opened the door for everything that followed. Number 4, cagrilintide. This peptide works differently. It's an amylin analog, meaning it mimics a hormone that helps regulate satiety and slows gastric emptying. When combined with semaglutide, studies have shown enhanced weight loss beyond either drug alone. This combination approach, stacking hormones, could define the next generation of obesity treatment. Instead of one pathway, future therapies may target multiple signals simultaneously. Number 5, tesamorelin. Sold as Agrifta, tesamorelin is already FDA approved for reducing visceral fat in HIV patients, but its broader implication is huge. It shows that peptides can selectively target harmful fat without extreme weight loss. Over the next 5 years, similar peptides could be developed to target specific fat depots, making fat loss more precise and medically targeted. Number 6, BPC 157. Now we move into a different category, regenerative peptides. BPC 157 is widely discussed for its potential role in healing tissues, reducing inflammation, and accelerating recovery. While human clinical data is still limited, preclinical studies and anecdotal reports have made it one of the most talked about peptides in sports and recovery communities. If future research validates its effects, it could revolutionize injury recovery and rehabilitation. Number 7, TB 500. Closely related to thymosin beta 4, TB 500 is another peptide associated with tissue repair, angiogenesis, and recovery. It may support muscle healing, reduce inflammation, and improve flexibility. Like BPC 157, it sits in the experimental space, but its potential impact on recovery medicine is massive if validated. Number 8, CJC 1295. We discussed this in our previous video comparing it with tesamorelin. CJC 1295 stimulates growth hormone release by mimicking GHRH. Its ability to increase IGF-1 levels and support recovery, fat metabolism, and muscle preservation makes it a key player in performance and anti-aging discussions. While not FDA approved, its mechanism represents a broader trend, using peptides to optimize hormonal rhythms rather than replacing hormones directly. Number 9. Ipamorelin. Often paired with CJC 1295, ipamorelin is a growth hormone secretagogue that stimulates natural GH release without significantly affecting cortisol. This makes it attractive for those seeking cleaner hormonal modulation. In the future, refined versions of such peptides could be used clinically to treat age-related hormone decline. And finally, number 10, the future pipeline. This isn't just one peptide, it represents the next wave. Pharmaceutical companies like Eli Lilly and Company and Novo Nordisk are actively developing multi-agonist peptides, oral peptide formulations, and longer-acting versions that could last weeks or even months per dose. We may soon see peptides that combine fat loss, muscle preservation, and metabolic health into a single therapy. Now, step back for a moment. Look at what all these peptides have in common. They don't just treat symptoms, they regulate systems. They control hunger signals. They influence hormone release. They accelerate healing. They modify metabolism at a cellular level. This is not traditional medicine. This is signaling-based medicine. But there's also a reality check. Many of these peptides are still under research. Some are not approved. Some lack long-term safety data. And in 2026, misuse is rising, especially in online markets where purity and dosing are uncertain. So while the future is exciting, it also requires responsibility. Because the same molecules that can transform health can also be misused without proper understanding. And here's the deeper question. If peptides can control hunger, fat storage, recovery, and even aspects of aging, what happens to the idea of discipline, of diet and exercise? Do they become less important or more important than ever? Because even the most advanced peptide cannot replace a broken lifestyle. It can only amplify what's already there. So now I want to ask you something. Out of these top 10 peptides that could change medicine in the next 5 years, which one do you think will have the biggest impact? Will it be retatrutide dominating fat loss? Or regenerative peptides like BPC 157 changing recovery? Or something we haven't even seen yet? If you want to stay ahead of the curve and truly understand where peptide science is going, subscribe to Peptide Culture right now. And drop your answer in the comments. Which peptide do you think will define the future of medicine?